Hello, uh, my name's Professor Miles Prince. I'm a haematologist and I work at Epworth Healthcare and Peter MacCallum Cancer Centre. I'm also the chairman of the Medical Scientific Advisory Group for the Myeloma Foundation, and I'm giving your weekly update on COVID for patients with myeloma. I'm based in Victoria, so I'll give you a bit of a Victorian perspective as to what's happening down here. At the moment, as you probably heard, we're getting about 300 to 400 new cases of COVID-19 diagnosed every day, which is very much equivalent to what was being seen in the UK at around their peak. It's important to realise that we're looking at, those figures are based on about 4 million people for Victoria, at about, and perhaps a bit less when we're looking at the metropolitan environment, 300 cases a day. Compare that to the equivalent 70 million people in the UK, and we end up about the same numbers. And what we're seeing is that our health system is already started to be put under some pressure, but handling it extremely well. I think the key ultimately is that medically we are prepared for the COVID situation. Social distancing is critical. Developing the infection from asymptomatic people rather than people with high viral loads leads to less severe infections. Recognition of making sure that people with high risk comorbidities are keeping strict social isolation is going to keep patients out of ICU and ultimately reduce the mortality rate. All of these are critically important aspects. So the key thing to say is that one, I think we'll handle it well. And in many ways, this is an expectation that the governments were predicting. I was telling my patients back in May, we're expecting 300 patients a day, but we will handle it much better. The patients who are getting sick are those with significant comorbidities, not necessarily blood cancers actually, but the comorbidities of being old, being obese, renal problems, and uncontrolled diabetes. Now, if you have any of those situations, you are at a higher risk, and it's probably more those that we worry about than the actual myeloma. So patients need to be very careful, particularly if they've got significant comorbidities. Wearing masks is important, it's helpful, but it doesn't protect you from the virus itself. What it does is it enhances social distancing. It does reduce some of the droplet spread, but viruses can pass through the mask. So don't assume if you've got a mask that you don't have to social distance. You must stay away. You must be very aware when you're in contact with people. So please wear your masks when you can't control social distancing, but don't assume the mask is going to protect you in any way or any major way. You need to maintain the social distancing. Don't forget to use the COVID app because that helps tracking. So if you haven't got a COVID app, get the COVID app, switch it on, and tell your friends, because it's very important that families, and last but not least, have your what I call bushfire plan. In other words, if you're at home and there are people that are coming in and out of the home, and the typical scenario is if you've got kids that are school age, and suddenly you get a phone call saying, "Oh, your son James has been sitting next to Peter, whose family has been diagnosed with COVID, or he's himself has been diagnosed, and your son's on the way home. What do you do?" Well, every situation is different, but be prepared. Testing is help. You'll be told, but you need to work out social distancing within your own home. So think about that plan if somebody in close contact has got COVID and how you are going to respond, and you'll be okay. So first of all, everything is going well. I think my take on the situation is that there is a calmness, but we're in this particularly for the next few weeks. Victoria is in the midst of it, and there is an expectation that it will spread. How is unpredictable, and we'll learn about this over the next few weeks. So stay safe, take care, bye.